Chapter number 2: Healthcare Services in India. In a democracy, the government is responsible for the well-being of the people. Therefore, it is also responsible for developing, implementing, and monitoring plans and programs for improving the health of the people, which has a large impact on the fitness of the nation. Therefore, it is vital for the government to arrange for medical facilities to care for and protect its citizens from a range of ailments. Health. Health means to remain free from any kind of sickness or injury, which could be physical or psychological. Good health in broader sense encompasses several other factors such as access to clean drinking water, pollution-free environment, adequate nutrition, hygienic living conditions, an active stress-free life. In order to combat health-related issues, we need to have suitable healthcare services like hospitals, laboratories, blood banks, latest equipments, medicines, and qualified doctors and nurses to promptly diagnose and treat all kinds of ailments. Healthcare in India. Let us look at some facts related to the healthcare services in India to understand the present scenario. India has the largest number of medical institutions in the world, from where 15,000 medical experts pass out every year. Since 1950, there has been a considerable increase in the number of healthcare facilities, especially hospitals. From 2,717 hospitals in 1950, it has grown to 18,218 hospitals in 2000. There has been a surge in medical tourism. People from all over the world came to get themselves treated at hospitals which are comparable with the best in the world. India is the fourth largest manufacturer and a leading exporter of medicines in the world. Almost half the children in India do not get sufficient food and suffer from malnutrition. A majority of India's population do not have access to clean drinking water. It is a fact that 21% of all infectious diseases are waterborne. As a result, a large number of people suffer from diarrhea, jaundice, hepatitis, cholera, etc. Even after so many years of independence, approximately 5 million people die from tuberculosis every year. In addition, about 2 million cases of malaria are reported every year. In comparison to urban areas, the ratio of qualified medical professionals and healthcare facilities in the rural areas is appallingly low. Moreover, in large parts of rural India, people still have to travel long distances to consult a healthcare expert. Often people die due to lack of prompt and apt treatment. Hence, it is obvious that as a result of extraordinary improvement attained in the field of medical sciences and availability of good doctors, nurses, and medical facilities, India certainly has the ability to take care of its large population. However, despite so many encouraging advancements, a large proportion of the population of our country suffers or dies due to delay in treatment or inaccessibility to proper healthcare facilities. In this chapter, we examine the reason for this ironic state of affairs and also the measures government has adopted to resolve the issue. Story of Mukunda Bala. A 65-year-old man, a mason by profession, fractured his hip bone in a mishap near his residence in Barberia near Kolkata. Bala was at first taken to the Barsad District Hospital, from where he was referred to the R.G. Carr Medical College and Hospital, as the previous one did not have the requisite facility to carry out the surgical procedure. He was, however, denied admission by the R.G. Carr Medical College and then by the Medical College and Hospital, Kolkata, and the NRS Medical College Hospital too, on the excuse that there was no vacant bed. This happened in spite of a Supreme Court ruling according to which no hospital can deny admission to an emergency patient. After spending 4 days in utter agony and pain, he was finally admitted at the Calcutta National Medical College on the 5th day. after the media reported his story and the apathy of government-run hospitals. Cost of cure. Shirish and Raghu are childhood friends, but come from very different backgrounds. Shirish's father is businessman, while Raghu's father is a sales assistant at a superstore. Every evening they play football in the nearby park. Raghu, where have you been? Asked Shirish as they entered the park. I had fever and diarrhea, said Raghu. Shirish responded, Me too. Did you go to the hospital? Yes, said Raghu. Shirish could not control his excitement and stated, recounting his visit to the hospital. The hospital was so stylish, just like a five-star hotel. Dad said it was a private hospital and one of the best in the city. At the reception, we paid rupees 500 as consultation fee and were asked to wait at the lounge in the children's ward where melodious music was playing in the background. When our term came, a woman doctor examined me and asked to get certain tests done, for which we had to deposit another rupees 2000. I was afraid, but the man who took my blood samples for testing was friendly, said Shirish. The other day, we again went to collect the test result and consult the doctor. The doctor went through my reports and said, Nothing to worry, he has contracted stomach infection. Since he appears to be dehydrated and weak, we will admit him and give saline. I am also prescribing a 7-day course of 2 tablets for stomach infection and 1 for fever. I was in the hospital for 7 days and had a gala time. I had a big room with a television in which I could watch all my favorite cartoons. How was your hospital? Asked Shirish. Raghu said, well, nothing like yours. We went to a government hospital and stood in a long queue at the OPD counter at 9 a.m. After almost 2 hours, when our turn came, the doctor examined me only for 2 minutes and prescribed me a few tests. We again went through the ordeal of standing in a long queue. In the testing laboratory, people were pushing and shoving each other. All this made me more sick. We were asked to come and collect the report after 2 days. After 2 days, we went to collect the result. The doctor glanced through the report and mentioned that I had diarrhea. He prescribed me medication for stomach infection and asked me to drink boiled water. He said it was normal for children to fall sick during this season. Shirish said, we spent over rupees 4,000 on my illness along with my heavy dose medicines I had to take. Raghu was surprised to hear the amount Shirish had spent, since he just had to spend rupees 150 on hospital and medication. Public health services. Public health services, the backbone of healthcare services in India, are a string of dispensaries and hospitals run by the government in rural as well as urban areas. Their purpose is to provide quality healthcare services either free or at low cost. It is called public primarily for 2 reasons. First, they are established to accomplish the pledge of providing superior healthcare services to all citizens. Second, the taxes that we pay are used for running these facilities. At the village level, we have small health centers with a trained nurse and a village health worker who deal with minor ailments. They work under the supervision of the primary health center, that is PHC. The doctors at PHC normally oversee the work of many villages. At the district level, district hospitals are there which have specific facilities for testing and treatment and watch over the functioning of health centers. In cities, there are large government hospitals. The treatment at these hospitals is cheap, but most of these hospitals have shortage of medicines, beds, equipments, and qualified staff. Besides, public health services are also responsible for organizing health camps in order to spread awareness about diseases like polio, hepatitis, malaria, chikungunya, jaundice, and tuberculosis. For example, Certain Sundays are assigned as polio days on which children below the age of 5 are vaccinated against polio virus free of charge all over the country. Campaigns of sanitation and waste management are regularly planned in local languages by the government. As per our constitution, it is the prime obligation of the government to not only ensure the well-being of the people but also give essential health care services. It is the job of the government to preserve the right to life of every citizen and provide necessary health services. If hospitals fail to provide prompt and timely medical attention, it could cost someone's life. The neglect on the part of hospitals could have cost Mukunda Bala his life. Moreover, as discussed earlier, hospitals cannot turn away emergency patients. Medical personnel are bound to provide all forms of treatment in times of emergency. Private health services. Besides the public health services, in urban areas, there are numerous private clinics, hospitals, and nursing homes that provide specialized health services. In rural areas, there are registered medical practitioners, that is RMPs, to treat patients. These days, many large corporations run hospitals, laboratories, and even undertake research and development in the fields of medicines. Even private medicine shops are part of this system. Unlike the public health system, they are expensive and not within everyone's reach. Healthcare and equality. In the last few decades, we have seen a remarkable growth in private health services, especially in urban areas. As their prime objective is to earn profit, the cost of services is very high and it makes it out of bounds for the common people. Medicines have become so expensive that often illness in the family becomes a cause of worry. Doctors and hospitals to engage in unfair practices and encourage the most expensive treatment for the patients. For example, in the story you have read in this chapter, you noticed how for a simple case of diarrhea, Shirish was hospitalized, prescribed so many medicines, and had to pay an inflated hospital fee. In fact, only a very limited section of the society can afford medicines that one requires during illness, and it is also a cause of rural family debt in India. 40% of the population admitted in the hospital for some ailment has to take a loan or put up for sale some possession to pay for the treatment. It causes suffering for even those who do not fall in the category of poor. Even though private health facilities are costly, a majority